my channel. In this session, I will be discussing about the axillary artery and its important relations. We know axillary artery is again a favorite question for, it can come as an essay question or it can come as short note question. So let's see how we get the relations and which are the main branches of the axillary artery. So we know, first we have to know what is axillary artery. We know there is a major artery from the heart that is known as aorta, which has got an ascending aorta, which has got an arch of aorta and descending aorta. Then it goes to the abdomen as the abdominal aorta. This basic knowledge you should have so that you will know from where the axillary artery is arising. So from the arch of aorta, on the left side you have a direct branch known as left subclavian artery, and on the right side, the right subclavian is actually arising from the common brachiocephalic trunk. So we have right and left subclavian arteries. So what happens is, this is the outer border of first rib. So at the outer border of first rib, the same subclavian artery will be becoming axillary artery, and that is how you get right and left axillary arteries. So we have to say what about the extent of the axillary artery. So it is actually a continuation of the subclavian artery. This is the subclavian artery at the outer border of first rib until the lower border. This is the teres major muscle. So at the lower border of teres major muscle, from the outer border of first rib, you have the axillary artery. So it's continuation of subclavian artery, and at the lower border of teres major, it becomes the brachial artery. So that is how you get the axillary artery, and since this part is confined to the axilla, we call it as axillary artery. Now we know it is divided into three parts by a muscle which is lying over it. So this muscle which is lying over it is known as pectoralis minor. So we know due to the presence of this pectoralis minor, we have a segment before pectoralis minor or above pectoralis minor, that is known as the first part of axillary artery. Then the part which is lying beneath the pectoralis minor, you call this part as the second part, and below the pectoralis minor, you call the part as third part. So these are the three parts of the axillary artery. Now when we talk about the branches of the axillary artery, it is very easy. One branch from the first part, two branches from the second part, and three branches from the third part. So the rule is 1, 2, 3. 1 from first part, 2 from second part, and 3 from third part. Now let's see the names of the branches for the time being. The first branch from the first part is the superior thoracic artery. Superior thoracic artery. Now we have two branches from the second part, which the part is actually lying under the pectoralis minor. So this is thoracoacromial artery and this is lateral thoracic artery. So these are the two branches arising from the second part of axillary artery, and we have three branches from the third part, one branch going down and three up. The one branch which is going down is subscapular artery, which later divides into circumflex scapular. So this winding branch is known as circumflex scapular artery, and this one is thoracodorsal artery. And the other two branches are anterior and posterior circumflex humeral artery. So three branches from the third part. Subscapular artery, which divides into circumflex scapular and thoracodorsal. We know subscapular artery is the largest branch out of all the branches of the axillary artery. Then two branches which winds around the surgical neck of the humerus. They are the anterior and posterior circumflex humeral arteries. So this is how we get the axillary artery and its branches. Now when we talk about the important relations of the axillary artery, we have to keep something in our mind. That is, we know this is lying in the axilla. So when we approach the region of axilla, we know we had the skin, the superficial fascia, the pectoralis major muscle, and when we removed the pectoralis major, we saw the pectoralis minor and further relations. So in all the relations, the superior relations, we have the skin, the superficial fascia, and the pectoralis major muscle. That is very important. Now, what about pectoralis minor? We know that pectoralis minor is that part is seen where you get the second part of axillary artery. That means the part of the axillary artery which is lying underlying the pectoralis minor, you call it as second part. So this is the second part, this is the first part, and this is the third part. Okay, so in the second part of axillary artery, when you show the relations, you can show the pectoralis minor. So where in all the other cases, you can show only the pectoralis major muscle. So once again, I will say the superior relations. We have the skin, we have the superficial fascia, we have the pectoral fascia covering the pectoral muscles, and the pectoralis major is actually spanning around all over the axillary artery almost. And pectoralis minor you will get only covering the second part of axillary artery. So if you know these relations, these important points, then the superior relations of the axillary artery is clear. Now we will discuss about the inferior relations. Inferior relations, we know this first part is actually lying closer to the thoracic cage. There you have the serratus anterior. Now as it reaches towards the base of the axilla, we have the subscapularis, and as it is reaching the third part, we know it is actually continuing as the brachial artery at the border of teres major. So apart from subscapularis, we have one more muscle at the third part as related to the third part of axillary artery, that is teres major. So inferior relation, it is again easy. Serratus anterior at the first part, inferior relation, since it is lying closer to the thoracic cage. Then as it moves out, we have the subscapularis in the second part, and in the third part as inferior relation, apart from the subscapularis, we have the teres major muscle. So these are the important muscular relations seen superiorly and inferiorly. Now we will move on to the immediate relations around the axillary artery. So we can see that the red color is the axillary artery and the blue color is the axillary vein. So in all the diagrams, you have to mention the red color axillary artery, of course, and medial to it you can show the axillary vein in all the three diagrams which you draw to show as the relation. So axillary artery, and you have the axillary vein line medial to the axillary artery. That is one and first and the foremost point which you have to keep in mind. Then the important relations will come in the form of nerves. Nerves means we have the brachial plexus mainly related, and in the first part and second part we have the chords of brachial plexus mainly, and in the third part we will be showing the branches, because after the second part the chords are dividing into branches, and these branches will be seen lying around the axillary artery. So that point also you have to keep in mind. So let's see one by one which are the nerves which you get in the first part, closely related. So when we talk about the chords of the brachial plexus, it is very easy. We have the three chords, the lateral chord, medial chord and posterior chord. So in the first part, the lateral chord and posterior chords, they are lying lateral, whereas the medial chord is lying inferior to the axillary artery. Now we know the pectoralis major muscle is there, so it has got two nerve supplies, that is the lateral pectoral nerve and medial pectoral nerve. So you can show the lateral pectoral nerve arising from the lateral cord and medial pectoral nerve arising from the medial cord, and we can show an anastomosing loop between the lateral and medial pectoral nerve which is actually crossing the superior aspect of the axillary artery. So we can think about that muscle and we can think about the nerves related with pectoralis major, so lateral and medial pectoral nerves. Likewise, we have the serratus anterior inferiorly, so which can be the nerve? It is the long thoracic nerve of Bell, which is closely related to the serratus anterior. So this is actually lying inferior to the axillary artery. So first part relations are over. Superior, we have the skin, superficial fascia, pectoral fascia covering the pectoralis major. Inferiorly, since it is lying closer to the thoracic cage, we have the serratus anterior. Then medially, we have the axillary vein, which is seen commonly in all the three sets of in all the three parts as a major relation. And talking about the nerves in and around the axillary artery, laterally we have the lateral and posterior chords. Inferiorly, we have the medial cord and the nerve to the serratus anterior, that is the long thoracic nerve of Bell. And we can see a connecting loop between the lateral and medial cord, which are the lateral and medial pectoral nerves arising supplying the pectoralis major. So there is a connection loop between the pectoral nerves as well. So that finishes the important relations of the first part of axillary artery. Now let's see the second part. Second part we have already seen, it is lying under the pectoralis minor. So superior relation, skin, superficial fascia, pectoral fascia covering the pectoral muscles, where here we get pectoralis major and minor. Inferiorly we have the subscapularis. Then medially always the axillary vein, and here this is the region where the chords of the brachial plexus are named medial, lateral and posterior. So that is, we get the relations of the brachial plexus chords as medial to the axillary artery in the second part, posterior to the axillary artery again in the second part, and lateral to the axillary artery again in the second part. So the chords are named medial, lateral and posterior to the axillary artery with reference to the second part of axillary artery. So the second part relations are very easy. We can show the chords of the brachial plexus lateral, medial and posterior in the second part as the name is given. That is, medial chord can be shown medially, posterior chord can be shown posteriorly, and the lateral chord can be shown laterally. So that is the second part. And talking about the third part, superiorly we have already mentioned skin, superficial fascia, pectoral fascia covering the pectoralis major. Inferiorly, apart from subscapularis, we know this is the part which is closer to the teres major, because from the third part we know it is continuing as the brachial artery. So apart from the subscapularis, we can show the teres major. Then medially, of course, always the axillary vein. Then laterally, we can show one more muscle, that is the coracobrachialis. So coracobrachialis is also seen at the lateral part. Now let's see which are the nerves seen in relation with the axillary artery. So we can think about the branches from the chords. So from the lateral cord we have the lateral pectoral nerve, musculocutaneous nerve and lateral root of median nerve. Lateral pectoral nerve we have already shown in the first part, so it is not shown here. So the rest of the two parts, that is, this is the lateral root of median nerve and this is the musculocutaneous nerve. So instead of the lateral cord, it can be replaced by two branches of the lateral cord, that is the lateral root of median nerve, which is actually continuing as the main trunk of median nerve, and you have the musculocutaneous nerve which is supplying the coracobrachialis. Now from the posterior cord we know the code is ultra, upper subscapular, lower subscapular, coracodorsal, radial nerve and axillary nerve. So out of these 5 branches, we can show the radial nerve and axillary nerve as the inferior relation. So directly lying below the axillary artery is radial nerve, and just lateral to it you can show the axillary nerve. So from the posterior cord, 2 branches. From the lateral cord, again 2 branches. Now we will move on to the medial cord. Which are the branches you can show in the medial cord? So medial cord, we know the branches are medial pectoral nerve, medial root of median nerve, medial cutaneous nerve of forearm, medial cutaneous nerve of arm and ulnar nerve. My mummy makes me ugly. That is the code which we usually use to remember the branches arising from the medial cord. So out of these 5 branches, we know medial pectoral nerve we have already mentioned in the first part. So all the rest of the branches are seen related to the third part of the axillary artery. So let's see. Superiorly, we can show the medial root of median nerve, which is joining with the lateral root to form the main trunk of median nerve. Then after that, we can show between the axillary artery and axillary vein 2 nerves. One is medial cutaneous nerve of forearm, which is lying superficially, and the ulnar nerve directly lying below it. And outer to it, that is medial most, medial to the axillary vein, we can show the medial cutaneous nerve of arm, which is lying closer to the arm, isn't it, to supply the skin of the arm. So that will be lying more superficial because it has to supply the skin of the arm. So 2 branches from the lateral cord, 2 branches from the posterior cord, and 4 branches from the medial cord. So these are the branches which are related to the third part of axillary artery. Hope it is made clear for you. So please do leave a comment if you find it useful. Thank you. Thanks for watching.